Guys, welcome back to our 11th part of RRB MCQ series. So till now we have completed our 10 parts and this is our 11th part. Here we will be discussing further some important questions which are related to RRB examination. So let's begin. So the first question here we have, it says the clinical presentation of nephrotic syndrome are all except. So all there will be three options which will be the indication while one will be not an indication. So let's see the options first. It says increased proteinuria, option B is increased hematuria, option C is lipiduria, and option D is hypoalbuminemia. So what will be the right answer? So the right answer will be increased hematuria. Since we are talking about nephrotic system and not nephritic, so in nephritic only hematuria is higher, not in nephrotic, so this will be exceptional. So nephrotic syndrome is characterized by massive proteinuria, hypoalbuminemia, edema and lipiduria. Hematuria is more typical in nephritic syndrome and not in nephrotic syndrome. Moving to the second question, it says which is the smallest distance at which the eye can see objects clearly without strain? So this question is from the physics part of the science segment asked in RRB. So you need to know the basic of these questions because they are also asked, and their weightage is around 10 questions are asked from the general science segment in the RRB exam. So make sure you also revise such questions. So let's see, since it says the smallest distance at which the eye can see objects. So option A is light point of the eye, option B is far point of the eye, option C is near point of the eye, and option D is normal point of the eye. So we all know, I guess you might be also knowing it. So the answer will be near point of the eye. So the near point is the minimum distance at which an object can be seen clearly without strain, normally about 25 centimeter in adults. Moving ahead to the third question, it says in humans the upper pole of the kidney lies opposite to the level of dash thoracic vertebrae. So when we talk about the kidney, we know in anatomy we have also read that the kidney lies in T12L3 region. So generally the kidney lies in this particular area. So now it is asking for the upper pole of the kidney. So the upper pole will be T12. So the right answer will be 12th thoracic vertebra. If it have asked the lower pole, then we will be answering number 3. Moving ahead to the fourth question, it says in CVVH solutes are removed by which of the following method? So CVVH is modality of CRRT. It is continuous veno-venous hemofiltration, and when it is hemofiltration, we know the answer will be convection. So let's see the answer. It says in continuous veno-venous hemofiltration, solutes removal occurs mainly by the convection, whereas solute move along with the fluid removal. So what happens in convection? Generally the fluid will be rapidly getting removed. Let's say this is our SPM. So what will happen? Small solutes will also get dragged along with the flow and they will also get removed. So this is what we call this phenomenon as convection. Let's move to the next question. The question number 5. It says the antibiotics which function as an inhibitor to nucleic acid synthesis is inhibitor. So we have to find the antibiotic which also function as an inhibitor to nucleic acid synthesis. So option A is tetracycline, option B is penicillin, option C is cefotaxime, Option D is ciprofloxacin. So the answer will be ciprofloxacin. Now, ciprofloxacin is a drug from the fluoroquinolone family, and it inhibits DNA gyrase, thereby blocking bacterial nucleic acid synthesis. This question is from the pharmacy part, and some questions are generally asked from this part also. So make sure you revise all the drugs which are related to dialysis as well as from the transplant point of view. Let's move ahead to the sixth question. It says hypersensitivity reactions were reported in patient dialyzed with AN69 membrane who were also taking which of the following drugs. So it is a classic case of adverse reactions. Here generally what happened, hypersensitivity was seen in certain group of patients who were using AN69 membrane dialyzers and were also taking drugs, antihypertensive drugs, and to be precise, they were taking the ACE inhibitors. So what happened, they developed adverse drug reactions, and so this question is also related to that particular part. So patients using ACE inhibitors may develop hypersensitivity reaction, and they are generally dialyzed when dialyzed with AN69 membrane due to bradykinin accumulation. Moving ahead to the seventh question, it says following are emergency indication for dialysis except, so we have to find the exception here. Rest all three will be the indication for doing emergency dialysis. So hypokalemia is the first option. Option B is severe metabolic acidosis. So yes, if a patient is having severe metabolic acidosis, we have to start emergency dialysis in such patients. So it is right. Option C is pulmonary edema. Obviously we have to start dialysis because the patient will be showing SOB, shortness of breath, and to cure that we have to start dialysis and we have to remove fluid. So it is also an emergency indication. Uremic pericarditis. Uremic pericarditis is also emergency indication for dialysis since the levels of urea are certainly in high range, and by starting dialysis we can lower those levels. So the remaining option is option A, hypokalemia. In generally what happens while we are doing the while we are treating somebody, mainly in dialysis, we encounter patients with hyperkalemia and not with hypokalemia. Hyperkalemia is more common in dialysis, not hypokalemia, so this will be exception. So dialysis emergency include hyperkalemia, severe metabolic acidosis, pulmonary edema, and uremic complication. Hypokalemia is not an indication. Moving to the 8th question next. It says among the options given below, choose the correct option which contains the parameters for dialysate delivery system. Dialysate delivery system, we have to find the parameters which generally are checked before the dialysate is allowed to be exposed to the blood. So option A is temperature, venous pressure, and flow rate. Option B is blood leak pH and arterial pressure. Option C is conductivity, pH, and flow rate. Option D is blood dialysate flow rate. So right answer will be conductivity. Conductivity is generally checked, pH is generally checked, and flow is also checked before. Flow rate is also checked before we simply expose the dialysate to the blood. So the right answer will be option C. So dialysate delivery system primarily monitors conductivity, electrolyte concentration, pH, and flow rate to ensure safe dialysis. Moving to the next question, it says the following are nephrotoxic drugs except. So there will be 3 drugs which are nephrotoxic. We have to find the one which is not. So option is amphotericin B, Option B is non-steroidal anti-inflammatory agents, that is NSAIDs. Option C is an acetylcysteine, and option D is gentamicin. So which of the following is not nephrotoxic? So I will suggest you to make one list of nephrotoxic drugs which are commonly seen in dialysis and transplant. That is going to help you, and remember that particular list. So in case you encounter such type of question in your examination, you will be aware of all the names of drugs. So here the right answer will be an acetylcysteine, because an acetylcysteine is actually renal protective and is used to prevent contrast induced nephropathy. Unlike amphotericin B, NSAIDs and gentamicins, so all these three are nephrotoxic. Moving to the 10th question, it says in humans, urine output less than 400 ml in 24 hours is called. So what it is called, that's the question is. So option A is anuria, option B is azotemia, option C is oliguria, option D is polyuria. So azotemia is related to urea levels which are very high in the person. Polyuria is meaning of polyuria is excessive urine output or excessive urination. Oliguria and anuria are the two options which might confuse you. So anuria, in anuria, what happens? There is no or negligible urine output, while oliguria consists of a certain range. And what is that range? So urine output less than 400 ml per day is termed as oliguria, and when we talk about anuria, it is negligible or less than 100 ml per day. Polyuria is excessive urine output. So these three are important terminologies when we talk about the urine output. So you have to be aware of all these three definitions. So this was all about this particular part. I hope these questions help you and were new to you. So next, the practice sheet of this part will be available in our Telegram group. So make sure you practice the questions from the Telegram group, and make sure you like this video, and have a nice day.